Can you hear me? Can you hear, guys?
Yes, sir.
So we are starting with the program. The students are starting it, and they will hand over charge to you.
The Dr.M.V.L.Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, the Dean of State GS Medical College and KM Hospital, welcomes you to this session of reminiscence. I would like to request the tech team to play the video about medical humanities.
Smart people. And who is it next to the student coordinator?
I think the only way we'll have to do is we have to call people to share on the other thing.
Oh,
The rest of them can be there, but I don't.
Yes, we are. Can we connect from our phones?
Yeah, connect from the phone. I'm not feedback to say, unfortunately.
I'm connected from the phone. But then from my
So this was about the Division of Medical Humanities. It is the students past and present that make our college what it is. So as our twin institute moved forward towards the centenary, we wanted to give a virtual platform to every batch of GSMC to share their fondest memories of college. Their thoughts and emotions will always be preserved forever in the form of their reminiscence. Now, I request the tech team to show the GAA membership form.
To remain connected to our alma mater and informed about the activities in the KM, including centenary celebration, we request you to become members of the Gosumec Alumni Association, the official alumni body at CGSMC. All the details and the membership of this membership form are available on the KM website.
Now, I request the tech team to show the 3 Gosumec foundation slides.
Karina?
Gosumec Foundation was established in California, United States to give back to our alma mater, which has helped so many professionally and personally. This website allows you to enjoy nostalgic content, including the history of our institution, medical humanities, archives, and much more. In this slide one, this website shows the web address, that is, you can see it, https gosumec.organization. At the footer of the website, there you can see the website. These are the website to the social media accounts, including YouTube, from where you can access the virtual reunions. Now for the slide 2, this slide shows the mission of Gosumec Foundation, which is first connect, contribute with the 3 T's and engage. Connect. Connect the global Gosumecs with our alma mater. Contribute to the alma mater's developing by sharing the 3 T's: time, talent, and treasure. Engage Gosumecs with nostalgic media on the continuous basis and enable global networking. Now, in the slide 3, this slide shows how to access the Google Forms, which many of you may have filled already from the link which was circulated in from your group lead. And the data from the Google form you can see here. Now, I would like to request the coordinator from the batch, Dr. Kalin Bakshi sir, to take over the proceedings.
Hello, Dr. Bakshi. Hello. Dr. Bakshi is there? Dr. Kalin Bakshi. Hello, Dr. Kalin Bakshi is there? Dr. Kalin Bakshi.
See, he's on this side and he's on.
Can you hear me now?
Yes, sir. Yes, sir. Now you can take over.
Okay, thank you. Turn off. Welcome everybody. You mute all the way.
Yes.
This is a little bit of a experiment on our side. It's got a little rocky start, but I'm glad it's getting better now. We are live from Washington, D.C. And as you can see, we have 2 groups in 2 rooms. We have switched on to a live feedback and also on a television camera. So it's our first experiment that we're doing, but it's wonderful to have so many of my classmates here. And so we will get started very soon. It has been a wonderful journey for batch of 64, and we have enjoyed a lot of memories. And we will be sharing that, in a sequence. The only request I have for all the participants who are going to share is going to really emphasize on what wonderful memories you have, positive things that you learned and became a wonderful doctor and a wonderful human being. And that's the intention for the medical humanities presentation today. So on that note, I'm just going to ask my co-host Hina Rajdev to say a couple of words before we get started.
Hi, I'm Hina Rajdev. I want to personally welcome everyone and thank you for joining us, the Gosumec class of 64, on our walk down the memory lane, stretching almost 6 decades. Next year, it will be exactly 60 years for our batch. Each one of us was influenced by a different teacher or in a very different way by the same teacher. These experiences together create a rich tapestry. We are on a tight schedule, and for everyone to have the opportunity, I request everyone to stay within the 60 to 90 seconds time frame given. Our first speaker today is Malti Damani, followed by Shanta Anand, and then Prakash Rao. So please be ready, Malti.
Hello, friends, class of 64. Let's go back into the memory land of first year of medical school. When delighted by just getting into medical school, thought that there was no one who can stop us from becoming a doctor. The first year MBBS, we tried to celebrate the college day by participating in the tipni, that Gujarati dance, folk dance, that we did it with long. I don't remember who were the other participants, but we met seniors as well as our classmates who took part in that. It was a lot of fun getting to know all of them. In the free time, we used to play the carom boards in the ladies' room. Then came the hard part, the first part exam, head and neck. And out of 14 students, only 2 passed. Dr. K.D. Desai advising all of us to get serious about study and leave all other extracurricular activities. I don't know how he used to know who is doing what, and he used to particularly tell us on us what we should improve on, and what bad habit we have to give it out. Then came along the second MBBS year, and we were elated again that pass or fail, you are still going to go into the third MBBS. So we all decided to go on trip to Mud Island and had a greatest time of our life. I still have a picture. If anybody is interested, I can put them on. And by now, we had a strong bonding between the people who started with A and ended to G. I did not remember much of
Malti, let's move on. If you can finish quickly what you have to say.
Okay, and the third MBBS was very fast, getting to know my soulmate and my teacher's influence, which took me to become a good pediatrician like Dr. Bhagat and Dr. Barucha.
Thank you.
Thank you.
Who's next?
The next is Shanta Anand and Prakash Rao after that. Shanta. She is in the Unmute yourself, Shanta. Okay, we'll come back to Shanta. Prakash?
Yeah, come on, yes. Hello, can you hear me?
Yeah, Shanta, okay.
Yeah. Hello, Dr. Natarajan and GS colleagues. We in the 1964 batch, we are a happy band from far and near. As their GSites, we gather here. We joined the institution with a lot of excitement, a little bit of ragging, and with a warm welcome by our immediate seniors, which is the batch of 1963. The first year MBBS was a real nightmare, as we had to dissect on the cadavers, which we eventually got over. We had very good teachers like Dr. S.M. Bhatnagar, Dr. Manu.Kothari, and Dr. K.D. Desai. As a student, I was impressed by Dr. Mrs. Parulkar. She was a very graceful and good teacher in physiology, along with Dr. Ramchandani and Dr. Biryani. On the clinical side, we had very good teachers. Dr. J.K. Mehta was one of them. He used to literally take us in the OPD behind the screen and show us in front of the screen. He used to take the patient behind the screen. For example, a patient with TB Cox, he would shake the patient and we could see the fluid literally moving in the cavity. That was the impact we had when we were in the third MBBS. Besides Dr. J.K. Mehta, who was one of the great physicians who impressed me a lot, during our clinical OPDs, he would literally take us behind the X-ray screen and show us the relevant signs. It has left an impact on our mind. We had also Dr. Store and Dr. Karanjawala, who were good in surgery. We had Dr. G.V. Parulkar, who later became the Dean of Medical College, and Dr. Ravi Bapat and Dr. Mungeka as our registrar. Dr. P.K. Sen, during our time, had done a cadaveric heart transplant, and Dr. Pardnani did the first kidney transplant in 1965 on a patient from his own living mother, from his own donor living mother. In ophthalmology, we had very good Professor Dr. B.K. Muscati, who was a great teacher and examiner. Dr. Vaiya was a good psychiatrist. And lastly, we had Dr. Dhurandhar for our skin clinic. And not to mention, not to forget, a few of our classmates who have done excellent, very well in our field is Dr. Pradhan Sultan, who is a world-renowned oncologist, Dr. Nivriti Patel, who is a founder of the Medical College in Macau, Hong Kong, and Dr. Prakash Kothari, who has established the Department of Sexology in GSM and KEM. Thank you.
Thank you, Shanta. Next is Prakash Rao.
Yes, go ahead.
Can you hear me? Hello?
Yes, we can hear. Yes.
Okay. Like, people have already introduced themselves to our teachers. My road is somewhat little different. We started off, as somebody explained, in head and neck. It took us 6 exams to get through the first part of the head and neck dissection. However, it teaches you something, that you're always learning throughout your career. Things keep changing. It's never static. New procedures come, long procedures become short, and the approach is different. Laparoscopic, minimally invasive, and so forth. Still, the results keep on improving. Doesn't get worse. So you got to keep on learning. That is my experience. Even after 50 years of being in a teaching institution, even after retirement, I feel that I'm falling behind in my knowledge. And that is what you learn from your experiences with your colleagues, which is very competitive, very collegial. And I still have some of my first-year partners sitting next to me. And we always look up to her because she was always one step ahead of me.
All of us work together.
And I think this is what makes US Medical College different. Very competitive, you keep learning, and you never stop learning. And hats off to my teachers. Thank you. I think my time is up.
Perfect. Next is Nivriti Patel and then Umed Shah.
Okay, can you hear me? Can you hear me?
Yes.
Yes.
Oh, all right, okay. I'm calling from Macau, and you must have read and heard and seen on the television. We had a dreadful time with the floods in Hong Kong, and we are in the recovery phase. So I have to be very quick because I have to go back to the camp to help out some of our staff. Now, as Shanta mentioned and previous speakers also have mentioned, great teachers, all the professors and honorary teachers. My associate was with Dr. Bhalerao, Dr. Padnani, and Dr. late P.K. Sen, whom I came to know later when I was a magazine secretary and he was vice president. Isa, Professor Arthur Dees, very, and the deans S.V. Joblekar. Okay, I have actually asked Dr. Avinash Supe now to write a book on dean. Up to now we have 15 deans of our medical school, and it is important for us to have reminiscence of all the 19 dean associated activities. Now, briefly, another 30 seconds. Our best teachers are our patients. Edward Memorial Hospital, KM Hospital, helped us to tell us their medical problems. They helped do physical examination. They swallowed the medicines we prescribed, and they gave informed consent for the procedures. So they are our great teachers too, and we must recognize them. And then the last word is about language and communication. Now, all the medical schools in Commonwealth and beyond, even in Macau, our language of instruction is in English, but the patient's language is whatever it is, Chinese. Whatever. Yeah. So, but I still remember my classmate who was not very eloquent in Marathi asking the patient, "Tumche pot kute hai?" Okay. And the patient was laughing like mad. Maje pot ite hai. Okay. Actually, he wanted to ask have you got any pain and all that. So language is a big issue in terms of patients. And the last story I'm going to tell you from Hong Kong is that Cantonese language had 9 different tones. This is a part of humanity curriculum. And so I had to learn a bit of Cantonese, which had 9 different tones. And 9 means is Gao. Gao means dog. And Gao Sao means professor. So John, who was the head of the department, I called him a dog by pronouncing Gao. Okay. And since then he said, forget it. Everybody has to speak with you in English. And so now I have to realize one thing is that our language of instruction may be English, but we have to respect our patient and learn their language to communicate better. Thank you. That's all about my 36.
Thank you, Nivritti. Umed is next.
Yeah. Can you all hear me? Good evening, everybody. I'm going to be very brief. From a small village of 2,000 in Gujarat, it has been an incredible journey to Bombay, to Washington, D.C. We started with 3 people from our family, a group practice, and now we are 140 provider near Washington, D.C. We are highly indebted to GS Medical College and KM Hospital. Thank you.
Well done.
The next person we will hear from is Chitra Dandekar.
Unmute yourself. Unmute, yeah.
Hello, everybody. It would be repetition of what everybody has said. I was very, very impressed with not only the teachers, the registrars, the demonstrators, everywhere, right from anatomy, physiology, to pharmacology, pathology, surgery, medicine, everybody. That's what each one has given added a little bit to what we have been given here. We have been happening to become in our later lives. Thank you. They play a lot of importance. Our teachers in our lives have played a lot of importance.
Next, I'm going to speak. I had a long journey from Burma to KM. Look here, KM Bombay, and then to US. Fortunately, we were well trained so there was not much change in terms of education. Here, there was not culture shock in that way. I continue to work at the Quaternary Hospital, which is a safety net hospital. And just to say a few words, I have been fortunate to have had the whole village of exceptional teachers to shape, mold, stimulate, and nurture me, just like the rest. It is impossible for me to speak and pick one or two. Those who stand out are Dr. Vasant Sheth, larger.
Sound is not there.
Sound, we don't hear you. Sound, please.
Then I can talk. Okay. Can you hear me now?
Yes, yes.
Okay. So let me start quickly. I said, I have been fortunate to have had the whole village of exceptional teachers to shape, mold, stimulate, and nurture me. It is impossible for me to pick one or two. Those who stand out are Dr. Vasan, larger than life, and with many firsts, Dr. P.K. Sen, Dr. Bhalerao, Dr. Yashwant Kher, and Dr. Dilip Trivedi. Dr. Vasan, a preeminent senior surgeon of his time in Bombay and a tyrant by reputation, was more than a teacher or mentor to me. His tenacity, his meticulousness, attention to details, and giving of himself wholeheartedly to his... Please mute yourself. Please mute yourself. His tenacity, his meticulousness, attention to detail, and giving of himself wholeheartedly to his pro bono KEM patients, same as his bridge candy patients, made deep impression on me and was formative. He would be hours late for rounds that everybody knew, with the registrar waiting for him at the door to receive him. But once he arrived, he was all yours. As long as you needed him for whatever the patients needed. There was not 2, 5, or 15 minutes per patient. His rounds often ended with chevdo and nasta from Sahyadri, all of us always shared with residents. I have tried to pass that on, his ownership of the patients and work ethic, to the next generation. And I'm deeply indebted to all the teachers, as other people have said. We wouldn't be where we are at or what we are without them. Thank you. The next person is Sham Borwankar and then Vinay Ranade. Is he here, Sham? Sham? Okay. Is it there?
Is Sham there?
Vinay?
Vinay. Please, okay. That's a Vinay. No, Sham Borwankar.
Okay, Sham.
Sham bola.
Sham, unmute yourself, please. Unmute yourself. Mute आहात तुम्ही. Sham? Hello? Can you unmute, please?
You can see.
I cannot unmute. Nobody can unmute. Here, can't unmute. Sham, can you unmute yourself, please?
Make some silence. Make some silence.
Dr. Sham, we're not able to hear you.
No, here it is.
Can we go to the next one? Go to the next. Okay.
Let's go to Vinay Ranade and we'll come back to Sham.
Hello, this is Vinay Ranade. I'm OB/GYN practitioner in Hartford, Connecticut in USA. I am retired now for 8 years, but what I learned in KEM Hospital was absolutely phenomenal. My great teacher, Dr. Shirish Sheth, made a big, huge impression on me. That's why I took OB/GYN. He was a great teacher, great person, still keeps in touch with all his students. And I learned a lot of things from him and many other teachers. I'm indebted to my education at KEM Hospital from my teachers and my patients. And all through my life, always from my patients, I learned a lot. Thank you again. I was very fortunate to be part of GS Medical College. I also practice homeopathy part-time now, which keeps my brain going well for learning new medical things, Next.
Is Sham on? Is he able to speak? Okay. Vinay Ranade is next. Yeah, sorry. And then Pramila Thakkar. And Rashmi Deshmukh. Okay. Rashmi Deshmukh.
No, Vinay.
Rashmi, unmute yourself. Yeah, I can see her.
Unmute yourself.
Yes. There she is. There.
Yeah.
Am I audible now?
Yes.
Am I
Yes, you are.
audible?
Yes.
Okay. Okay. Now yeah, as all of you have said, I'm also highly indebted to all my teachers, all my professors. Everybody has mentioned that. So that was a great thing that we had as our teachers, and not only our professors, but the understaff also, the demonstrators, everybody. But I want to tell you one very strange thing, that I would not have been here, because when I first joined KEM on the first day, I don't know what happened to me. I felt very lost. I felt that I don't want to be here. So every day I went to the outside and stood outside the dean's office. You won't believe this. And then I got so nervous, I used to come back. This I did about 3 days. And then finally I got the guts to go in. And I went in and I told Dr. Joglekar, I want to leave. I don't want to stay in this college. So he said, why? So I said, I didn't really know the answer, but he asked me, are your friends in another college? Are you not happy? Has somebody said something to you? That was not the case, nothing like that. But I don't know what happened to me. I don't know. I went crazy. But then what he told me was such good advice. He said, try it out for a month and come back and then tell me. And then after a month, you feel that you still want to leave, then you can go. So I went back and I never ever wanted to leave KM again. That's my story. Anyway, thank you very much. Thank you.
Very
Thank
nice.
you.
Thank you.
Thank you.
Hina Thakkar. And Sham, when you are ready, you can raise your hand. Or Hina Thakkar.
She's not there. Next.
Okay. Vijay Kusnur.
He's there.
Unmute yourself, please.
I am ready.
Hey, Anil, you
I
can
will
give
let
it.
somebody else.
Okay, next one.
Okay.
Nalini Juthani.
We overlooked Nalini Juthani. Sorry about that, Nalini. You go next.
Okay.
Thank you, Hina, and thank you, Kalin, for putting this together. My name is Nalini Juthani. My story goes back to the year 1970, when the dean of our medical school was Dr. Indani. I will share with you an incident which changed my life because of his caring humanitarian act. I had completed half of my internship, which did not include preventive medicine rotation. During that time, I got engaged to be married in 3 months, as my husband was to leave for the United States to start his training. We both wanted to live together. However, according to Dr. Pai, who was in charge of interns, without completing 3 months of preventive medicine, my internship would be incomplete and I would not qualify for my MBBS degree. I needed to also complete medicine and part of OB rotations. I talked to Dr. Pai, and if I completed 3 months of preventive medicine, could I complete the rest of my internship in the United States, where my husband was to do his internship? He said, nobody has done this before. I should talk to the dean. Dr. Indani was known to be a disciplinarian and strict with principles. I wrote a letter with my request, as I had discussed with Dr. Pai. The dean's office told me that the dean did not meet with anyone without an appointment. In a desperate, loud voice, I said I must see him as it was very urgent. Dr. Indani came out of his office and told the staff to send me in. I presented my letter with my request to him. He read the letter and said no one had requested to complete part of the internship in another country. He rolled down his reading glasses and looked straight into my eyes. Our eyes met. He said, sir, if this was your daughter, what would you do? There was pin drop silence. He rolled his reading glasses back and signed my letter. He said, take it back to Dr. Pai and good luck to you. Dr. Hindani requested the permission from Bombay University as a special case for me to do the internship the rest of the months in the United States. Although I lost some time, my husband and I left for the US together. I completed my internship there and received my MBBS diploma. I learned from this experience that the caring and humanitarian values play a powerful role as a physician leader. It helped me grow, and I applied this learning in my role as the assistant dean of my medical school in the United States. I became a psychiatrist, and my deep, deep gratitude goes to Dr. Hasmukh Parekh, who was my guiding force and the first from GS that I mentioned in my first interview in the United States. He told me, be a doctor, you will be excellent, but be a psychiatrist and people will remember you. Thank you very much for listening.
Thank you. Vijay Kusnur next.
I'm happy to be here today. After a not too stellar start in anatomy, I had a one-on-one meeting with Dr. Bhatnagar, and the rest is history. I was fortunate to have worked with Dr. Bhandarkar and Dr. Golwala, and subsequently with Dr. Nair and Dr. Pinto, Dr. Venkserkar, and Dr. Kale. I was lucky to be in the operating room when the first pacemaker was implanted in a patient after he had been on an external pacemaker for almost 6 months, waiting to get a permanent internal pacemaker. I was also fortunate to be in the cath lab with Dr. Venkserkar for the first ever balloon atrial septostomy in Bombay. Thank you.
Unmute your hours one. 42 મિનિટ બગાડી. એ લોકોને
Hello, any problem? Dr. Bakshi?
Whether anybody heard me or not, I have
No, we heard.
unmuted.
We heard
Can you
you.
hear me?
We heard it
We
well.
did hear.
You did not hear. Okay, can you hear me now?
Yes.
Yes.
Yes?
Yes.
Well, my name is Vijay Kusnur, and after a not too stellar performance at the first semester exam in anatomy, I had a one-on-one meeting with Dr. Bhatnagar, and the rest is history. I was fortunate to have worked with Dr. Golwala and Dr. Bhandarkar, and subsequently with Dr. K.G. Nair, Dr. Pinto, Dr. Kale, and Dr. Venkserkar. I was also fortunate to be involved in the first pacemaker implantation that was done after a patient was in the hospital for almost 6 months with an external pacemaker. And I was also fortunate to be in the cath lab with Dr. Venkserkar for the first balloon atrial septostomy performed in KEM Hospital and in Bombay. Those are my happy memories. Thank you.
Dr. Bakshi? Any problem?
Okay, can you hear us now?
Yeah.
Okay. Rekha, do you want to speak?
Next.
Okay. Usha Vakharia.
Hello, everybody.
Okay.
I'm just glad
Okay.
to see everybody, my classmates.
She's not ready.
And I don't have much to say.
Prabodh,
I have
we
my
can-
problem with hearing. Anyway, I got a lot of whatever you guys were
Prabodh,
saying. I
unmute
got
yourself.
a lot of it out of it though.
Who's talking?
And
Somebody's talking.
that's about it. Just enjoying life right now for grandkids and the kids and everybody. And living a peaceful life. Thank you, everybody. It was nice to see everyone.
Can you hear us now?
We can hear you. We can hear you.
Okay. Okay. Prabodh? Prabodh Damani? You have to speak up.
AM was the foundation was laid back by my anatomy and physiology teachers, Dr. K.D. Desai, Manu Kothari, and then most important thing in my life was clinical build-up. The Dr. Kher and Dr. Bapat stands out as a good mentor with late night classes. And then I worked a house physician under what we call Durandars of medicine in India, Dr. Date, M.K. Shah, B.C. Mehta, I can just Golwala, I can just enumerate neurology I did under Barucha. They all were great teachers, great mentors, and I'm indebted to all of them. Thank you.
Thank you, Prabhu. Vasanti? Okay. Vasanti? Vasanti doctor, and then Shamla Masurkar.
Can you hear me now?
Yes, we can.
This is, I'm Vasanti. I came from a smaller town, Kolhapur. In my school, I was doing very well. College there, I was doing very well and thought I'm a very clever person. Never failed anywhere. Came to Bombay. Getting admission in GS Medical from another university was a great thing for me. And then the first part exam, that was head and neck, I failed. So that was the first shock that brought me down to my ground level. And that is what has helped me, and I've remained like that forever. That helped me also to face my first attempt of MD, where I failed first attempt. That's all I want. All the rest of things are fine.
Thank you, Vasanti.
And it is nice to know that a lot of people have failed in the first attempt.
Okay. Sham Borvankar, are you back? Unmute yourself, Sham. Shamla? Shamla Masurkar?
No, it's a pleasure to see everyone. Seeing you after many, many years. I'm practicing in a small town in Karnataka called Gokak, and so far away from everyone that it's a pleasure to see everyone again. And everyone has told about the wonderful days we had in KM and college, and well, there's nothing else to add.
Okay, Sham.
Thank you.
Jai Shri Tyagi. Thank you. Jai Shri Tyagi, and then Shubhita Durve. Jayashree Tyagi, unmute yourself. Jayashree?
Can you hear me?
Yes, we can.
Okay. So it is very nice to go down the memory lane to see you all after such a long time. What I want to say is only at this age, what we have reached today. And you think about us when we were about 17 years old, 17, 18 years old when we joined the college, how many people have played a big role to make us what we are today. It is not only about learning medicine. I remember Dr. K.D. Desai telling how to have your posture when you are presenting a case. Madam Mota Shah in obstetric gynecology, she was an idol for me. To be an elegant woman and to practice and to show the intelligence by operating, that has motivated me a lot, and that's why I took obstetrics and gynecology. That is all what I want to say. It is very nice of Dr. Kalin Bakshi to make such a meeting, and naturally GS Medical College and Mr. Natarajan and all of you colleagues. Nice seeing you all. Thank you very much.
Thank you, Jayashree. Shubhada? And then Shaila Paralkar will be next. Shubhada, unmute yourself, please.
Hello, good evening. Nice to see all my classmates after so many years. It's wonderful to get connected with everybody. All of us have done so well, and we have got very sweet memories about our college and our teachers. All of them were really wonderful. They took a lot of efforts to teach us, especially all our registrars and everybody in the college and in the hospital. They were very, very nice. And that is why we are here now where we are. Thank you.
Thank you. Shaila Paralkar, and then Vinay Mardekar.
Your Highnesses, Excellencies, it's been large PGI, a joint mission by the
Okay, we can't hear you. Can you unmute?
2 years on, more large-scale projects are and we are
Can't hear. No. Okay, Vinay? We can't hear Shaila. Vinay Mardekar? Okay. Jayashree Mantri? Jayashree Mantri? Okay. All right. Then it is Harshad Patel.
Hello. This is Harshad Patel from the batch of 1964. You know, the one thing I want to tell the students of the GS Medical College who are presently studying there is we succeeded in this country only because of our strong clinical knowledge that we obtained in KEM Hospital as a houseman and residents. And a lot of praise goes to all our teachers that were mentioned, and there are many more that they were instrumental in teaching us the strength of the clinical medicine. On a personal level, I want to thank and express my appreciation to Dr. H.M. Dastur, the neurosurgeon. He was the chief of neurosurgery in KEM Hospital. Dr. Anil Pandya and Dr. Nakpal, who were in neurosurgery. I spent a short time in neurosurgery, but they gave me a wealth of knowledge in clinical medicine, not only limited in neurosurgery, but the entire medicine. Thank you.
Next is Viju Bakshi, as we knew her, Viju Char, and now Kinnari Bakshi.
Thank you, everyone. It's such a pleasure being part of this illuminated and well-versed doctors. My privilege was to be part of this group and this class. And for me, Dr. B.T. Muscati was my alma mater. I wanted to do surgery, but picked up ophthalmology as the first female resident to finish the whole course and get out of there, getting my MD in ophthalmology. The other accolade that I got from GS Medical was my partner and my soulmate, Kalin Bakshi. Thank you everyone for each and everybody that has played a part in my life. All of you speaking today, we have been friends before, as we know. And it's been a pleasure spending those 7 years together with all of you. Thank you.
Kalin Bakshi is the next person, and he is our final speaker.
Thank you, everyone. It's been a wonderful journey. And one of the things that I have to mention is that failure is the way to succeed. And like many of you have pointed out today, the first time I went for the part exam with Dr. K.D. Desai, I identified a muscle. And he looked at me, smiled gently, as you probably remember his smile, and said, yes, 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 but not in a human being. And that was the wake-up call for me. And now, interestingly, I'm studying comparative anatomy and physiology in animals as well. And so these seeds are sown, and you don't know how they come about. Same thing happened with Dr. K.T. Dholakia, one of my wonderful surgeons that I really admired him to orthopedics. And he was doing a hip examination in a clinical setting, in an outpatient department. I was standing next to him. I was the shortest guy, so I was next to everybody was tall. And after he finished the hip examination and he showed everything, and then he turns around and says, so does everybody follow how to do what are the various mechanics of the hip? So people were quiet. I was the only one who said, yes, I do. And so he puts a hand on my shoulder, turns around to everybody and says, what took me 25 years to understand, this kid understood in a minute. So there are memories like that. These are the things that go through, when we grow up in life. We really, same stories, are many stories with Dr. Sen and so on. But one of the things I want to mention last, as I end up this, is the GS stands for Guru Shishya. Guru Shishya was something that we totally learned. Every registrar, even houseman, registrar, and ward boys. Yes, I that's very good. Thank you. As a matter of fact, the ward boy, in OPD, Dr.M.V.L.Kothari, I still remember saying, "Saab, usko खून आता है नीचे से, दर्द होता है तो फिशर होता है, और दर्द नहीं होगा तो पाइल्स होगा." I still remember these kinds of stuff. I think it's amazing to how we learn from different people. And
How to apply cast.
And Ramchandra was the pune in the anatomy, and I bought a whole skeleton from him. I can remember that he used to sell. I mean, it's just one of those. These memories are precious to us. And as we grow up, but one of the things as Guru Shishya part is I want to stress is these people, they woke up nights. They would have Sunday classes, 4, 5, 6 hours, and they would put their heart and soul in teaching. This is what I admire. And this is exactly what we want to carry forward as the legacy of GS Medical. So that's basically what I need to say. And I really appreciate this whole efforts that Dr. Natarajan has put in. It's an amazing coordination that he has done. And with the medical humanities, we are really bringing out the best of the best in the GS. And that's what my feeling is. And I really appreciate all the efforts. And I know there's technology, you cannot argue with technology, you cannot cry and shout at technology, nor you can complain. Just work around. And so I appreciate the patience that everyone of you have shown us today. And we just hope that we can do more of these live combined hybrid sessions as a possibility. So thank you very much, and over to our organizer.
Hello, Dr. Bakshi.
Yes,
If
sir.
I could, take 2 minutes. Okay, it's been a team effort, wonderful effort from your side. 1964 batch. Okay, I think amongst all the events so far, putting the age factor also in place and technology, I think this would be a trailblazer for all the coming batches to follow and emulate, especially from the other end of the globe, connecting with at this time. The time must be early morning out there, I suppose.
Yes.
And yeah, and it's a team effort. Together, everyone achieves miracle. Medical humanities team. Okay, and the students of the first year and the third year also, and the technical support have all been made this possible. And just 1 more minute, 2 batchmates of yours who are no more, Dr. Sharadani Paidungat, who later on became Dr. Sharadani Dhanukar. She was heading the Department of Pharmacology and then went on to become Dean at Nair and was very much introduced into Ayurvedic. And Ayurvedic Research Center, she was one of the persons to be setting up in the KM hospital. And there is annual or biannual award called Hirvai Samman in her memory. And one more staff member from anatomy department, Dr. Jayantilal Shah, who is no more. He's also your batchmate. And quite a number of students are familiar with him. And thanks for those few minutes granted. I'll hand over the mic to pass on the baton to the students, Sejal and Saud. Are you there, Sejal and Saud?
Yes, sir.
Acha, before you wind up the proceedings, Dr. Bakshi, in case anybody wants to comment something more which they want to, because some batches we have had time till 7:30. Okay, so impromptu, somebody wants to add something, you're still welcome to go ahead. Time management has been excellent from your side. Okay, you have finished dot at 7. Okay, so now you have some.
Is Sham ready to talk? Sham, I see Sham here, but he has not been sharing.
Hi,
He's one
Kalin.
of the.
Hi, Kalin. This is Meena. I don't
Yes,
know.
Meena, go ahead. Go ahead.
Just like to say that nice to be here and wonderful effort. And I voice I'm with all my classmates. Our teachers were fantastic and gave us such good foundation. And practicing here for so many years, we have always been complimented on our clinical findings. And I think I owe it all to my basic training. So I will never forget that. And thanks a lot. Okay, bye.
Thank you. Thank you. Anyone else wants to say a couple of words? I don't see Borwankar anymore.
This is Pradeep Kulkarni.
Yes, Pradeep, go ahead.
Yeah, so I just want to thank you, Hina, and the organization of the medical humanities for putting this up. It's very fantastic, and the memories are continuing to bubble up in our minds. And thank you very much for organizing this, to Dr. Natarajan particularly. Thank you.
I think that pretty much covers everyone that I see here present. And Dr. Natarajan.
Sir, any memories related to extracurricular activities? Meaning, since you're very much fond.
I was like, go ahead. Anybody wants to share extracurricular activities? There were many people that were.
Oh my goodness, you wouldn't want us to mention all our extracurricular activities.
No,
it
no.
wouldn't be appropriate.
I
for this
married my
program.
extracurricular activity.
There's some, in case somebody is fond of music, etc., would like to sing impromptu right away. Okay, all meaning so that students of the present era get impressed by the stamina and energy in your batchmates.
Yeah.
Dr. Bakshi could recite a couple of.
Dr. Natarajan,
Yes, sir.
there's no music, but I commend, and I mentioned that earlier, that your responses in the middle of the night to any comments is very much appreciated. You've taken a lot of efforts in putting all this together, and I commend you for that. My name is Dr. Rao.
Yeah, thank you. So Dr. Bakshi is quite active in our multiple groups in WhatsApp. So maybe.
Right. What would you like me to do?
No, many some couplets or some. Okay, or some joke somebody could crack or whatever. That also will be
Jokes or something.
because some batches.
Any particular song you can whistle?
You can whistle one.
Whistle what? Just give me a
Yeah.
thing and I whistle.
Yeah.
Hello. Hello. Hello.
Cannot hear? Yes.
Yeah.
Cannot hear?
We can.
We can hear.
Can hear or no?
Yeah, we can.
Okay.
But we can only see rising moon, not the face. Now no sound.
We really have to get on. We have a appointment with President Biden. So we.
Thank you, everyone.
Thank you.
Thank you.
Now we'd like to play a small
Especially to the
reflections
students
video
who did
by
such a
Dr.
good
Swarika
job,
Bhagat.
Sejal.
It's a pleasure meeting everyone.
I would
Very
like
good evening to you all.
the
It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari, Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. J.S. Medical College, NKM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons, doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. J.S. Medical College and KM Hospital who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was literature and medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to this. For the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. G.S. Medical College and KM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us, the readers of the book. We, as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation of the sites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
We would like to thank our Dean Dr. Sangeeta Rawat Madam and Academic Dean Dr. Pathak for their continued support and encouragement. We thank the Gosumec Alumni Association for the administrative support for correspondence and financial transactions of Dr. M.V.L.Kothari Chair and Division of Medical Humanities. We thank Mr. Tushar and Mr. Badal for the audiovisual and technical support. Dr. Maitre for video recordings. Last but not the least, a big thank you to the batch for their enthusiastic participant. This reunion was indeed a memorable one. Thank you.
Thank you.
Thank you. Bye-bye.
Thank you very much.
And we end Dr. Natarajan and Bakshi.
Thank you. Thank you.
Thank you. Thank you.
Everyone.
Thank you, everybody.
Thank you. Thank you. Thank you. Can we stop the recording now?
Lovely to meet all of you.
Yeah. Dr. Bakshi, can we stop the? Yeah. Okay. Fine.
Hi, Rashmi.
Bye. Nice seeing you all.
Bye-bye.
Bye-bye. Bye-bye. Bye-bye.
Good to see you, everybody.
Lovely to see you all. Bye-bye. Have a lovely time.
And good memories.
Have a good time.
We'll say hello to the president for you.
You will say hello to President. He is in India. Bye, and
that's why we are allowed to get in, when the cat is away, mice get in,
Okay, bye-bye.
Bye-bye. See you.
Bye. Bye.
Bye.
Trade my shoes. No.